Hi, I'm Amy Marsalis, and I'm here with Nykia Babb, an amazing young woman with an incredible story to tell about what happened to her when she was just a freshman at the University of Tennessee, ended up having to have a heart transplant. Nykia, tell us what you were doing when you got so sick, what your symptoms were.
I was just laying down in my dorm room, and I felt laying back was harder to breathe. And I sat up and tried to walk around, and nothing really helped, so I knew it was something wrong, and I immediately called my mom.
You told me earlier that your heart felt almost like it was about to beat out of your chest. Can you describe that in more specifics about what you were feeling?
Well, I always thought it was normal, but I felt my heart beating a little bit, harder, and I felt it all the time, every day, every night. I felt my heart beating, and normally I asked the doctor, and he was like, "No, you're not supposed to feel your heart beating like that." And as I looked down, I could actually see my heart beating in my chest.
And you hadn't experienced that when you played basketball, volleyball in high school. This was a new experience for you.
The heart beating, the feeling was my whole. I felt it for a while. I never knew anything was wrong with it. But the breathing, hard to breathe, and getting tired, and that was all new to me.
What was the diagnosis when you finally got to the doctor? What did they tell you was wrong with your heart?
Well, and when I was in Knoxville, at first they said it wasn't, my heart was doing fine, there was nothing wrong with it, and they actually sent me home and just said it was a blood clot and gave me medicines for a blood clot. And then I actually passed out the night I came back to Nashville, and they said that I had an enlarged heart, and it was 2.5 times bigger than a normal heart.
Oh my goodness. So next step, you end up at the hospital, and they put you on the heart transplant list. How long did you have to wait to get a new heart?
They told me that I was going to get a transplant, and I was in the hospital for about 1.5 months, almost 2 months. And they put me on the list on a Monday, and I only waited 9 days until I was getting the surgery that next Thursday.
That is incredible. Were you just scared to death? I mean, I would think you would be so frightened about, in the first place, having to have a heart transplant and then waiting in the hospital hoping you get a heart.
I was actually I was lively and excited about it. I was ready to feel better. I was tired of being sick and sitting in the hospital. I was thinking about the after fact, and I knew that St. Thomas had great doctors, so I was just ready to feel better overall. So I wasn't really scared.
That's great. Speaking of the doctors and the medical staff surrounding you, if you could go back to them and talk to them, because they were there at your bedside, obviously, during this whole time and after the transplant, what would you say to them?
The experience I had at St. Thomas was wonderful. Dr. Tedder, Dr. Aaron, and Dr. Chomsky, they was all there every single day checking on me and letting me know how everything was. Dr. Chomsky, he actually told me he turned down 17 hearts before they actually picked the one that they wanted for me. So it was relieved to know that they was working that hard for one patient, and I'm sure they do that for every patient they have.
And as far as your activity now, that you're, several months past your transplant, can you do just about anything you want now physically?
Well, I just hit 3 months for my transplant, and it was February the 20th. So he said anything that I haven't been doing that I want to do, I can do now. But I'm sure I can't, overdo it. Yeah. But he said I can lift weights and run and work out, and I've been doing that every day. So he says that I'm welcome to work out and be active again.
That's great. I'm sure that's great for you to know that.
Yes.
And how has this experience changed you in terms of your life's goals, what you want to do in the future?
I always wanted to work with children, but after having the heart transplant, I want to treat someone how all the nurses and doctors was treating me, and to picture a doctor coming in your room and had a heart transplant, and you're like, oh, you know exactly what I'm going through. I would love to walk in someone's room and say, I've been through the same thing, everything's going to be okay. So I want to be a doctor.
Oh, that's incredible. Okay. Thank you. You're a real inspiration.
Thank
you
you.
really are. Thank you.